Hello, everyone. Hope you're all having a good day so far. Welcome to my 12th episode. Now, unfortunately, as of the development and recording of this episode, the coronavirus national death count is already at, sadly, 250,000 lives lost to this infectious disease. Today is Wednesday, November 25th, 2020. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. It's the day before Thanksgiving, and I wanted to give my thanks and gratitude to all of my supporters, listeners, friends, colleagues, and coworkers. Everyone has given me tremendous encouragement and feedback in the everyday work I do to provide value to you in the content I love to create. So, I've also transferred all of my podcasts onto video now on YouTube. My business channel is Paint the Medical Picture with all the words squished together, no spaces. Long story, with a name like mine, Sonal Patel, it may be unique here in America, but there are so many with that name worldwide, and so I could not use it for my channel. But you can find me at Paint the Medical Picture, all the words squished together. That's where you can find this podcast and me on YouTube, so please like it, love it, subscribe to it, do your thing. I'm working hard at developing other small videos, writing in more industry magazines, as well as chapters and compliance manuals, presenting more and more webinars for various AHIMA local chapters, medical associations, as well as compliance organizations. I'm trying my very best to work smarter towards meeting my mantra and tagline of, "We must do better." Now, are you interested in better capturing diagnosis specificity in your medical documentation? Well, I dive into it in this episode. This episode highlights the month's fraud, waste, and abuse cases from the OIG and my trusty tips on ensuring diagnosis code specificity. And I also share some wise words from our renowned American poet, Henry David Thoreau. If you check me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, go ahead and hit that subscribe button now so you don't miss an episode. Please write in a review and rating on Apple Podcast or wherever you listen to my podcast. I'd really love your support. Now, a quick disclaimer. Before I get started on the episode, this podcast episode and Nexsen Pruet podcast series do not constitute legal advice, but I am fortunate to work with the sound healthcare attorneys at Nexsen Pruet. And as their consultant, I have over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. Again, the opinions and insights throughout are mine alone, and they in no means constitute legal advice. So, let's get into Newsworthy. The month of November so far has seen all the usual suspects in criminal and civil enforcement cases. From states across the nation, the OIG identified cases of alleged wire fraud in schemes involving diverting funds away from foster children, to cases of alleged substance abuse and counseling services never performed, nor qualifying for reimbursement, and schemes allegedly involving seducing the elderly and the poor into giving away their personal information to fraudulently bill government payers. There was also a podiatrist who allegedly performed routine foot care but billed for more high-dollar surgical cases. Of course, DME cases, genetic testing, pain management, and anesthesia cases allegedly involved kickbacks and bribes, overcoding schemes by 24 hours in a day. And there was also a cardiology case involving allegedly fraudulent claims for professional services, but without generating an actual and required interpretive cardiac report. Of the 17 cases to date, almost every case involved hundreds of thousands of dollars in restitution. But the one case I'd like to focus on is about an OBGYN doctor who allegedly billed commercial and government payers for millions of dollars for irreversible hysterectomies and other surgeries and procedures that were not medically necessary for his female patients. This fraudulent scheme was allegedly occurring in the years of at least 2010 through 2019. During this period, the physician did not perform medically necessary services and would allegedly falsely tell his female patients that they needed the surgeries to avoid cancer in order to induce them to agree to the surgeries. This physician allegedly smoke and mirrored and swayed his way upon his trusting female patients and committed truly heinous crimes. A U.S. attorney for the Eastern District of Virginia has stated this physician, quote, has a history of fraud, including having his medical license and hospital privileges revoked. Nothing was going to stop him but the brave victims who testified against him and law enforcement. My thanks to the trial team for their outstanding work in what was a very complex case, and to our investigative partners for their efforts in helping bring him to justice, end quote. The evidence at trial also demonstrated that the physician allegedly falsified records for his obstetric patients so that he could induce their labor early, prior to the recommended gestational age that minimizes risk to the mother and baby, to ensure that he would be able to conduct and be reimbursed for the deliveries. The physician also violated the 30-day waiting period Medicaid requires for elective sterilizations by submitting backdated forms to falsely make it appear as if he had complied with the waiting period. Finally, the physician allegedly billed insurance hundreds of thousands of dollars for diagnostic procedures that he only pretended to perform at his office. The witnesses at trial included dozens of former patients, some of whom testified to the complications they continue to endure as a result of the unnecessary surgeries their physician performed. The witnesses also included nurses who worked at the hospitals where the physician performed his surgeries. They allegedly testified that they repeatedly complained about his practices to their supervisors. FBI agents in the case have stated, quote, doctors are in positions of authority and trust and take an oath to do no harm to their patients, end quote. Agents continue to say, quote, with unnecessary, invasive medical procedures, this physician not only caused enduring complications, pain, and anxiety to his patients, but he assaulted the most personal part of their lives and even robbed some of their future. The brave patients and nurses who came forward and testified deserve our gratitude for helping end this horrible scheme, end quote. Then, a special agent in charge for the HHS Office of Inspector General stated, quote, in his desire to line his pockets, this physician callously ignored his patient's health and well-being by conducting medically unnecessary and irreversible medical procedures, end quote. This agent goes on to say, quote, physicians who recklessly place patients at risk to boost their own profits will be held accountable for their actions, end quote. This physician faces a maximum penalty of 465 years in prison. He is scheduled to be sentenced on March 31st, 2021. Now, I always use the month's enforcement cases from the OIG to serve as yet another tool in my toolbox when I communicate with healthcare professionals, our providers. They need to be aware of the why and the what and the how to ensure they stay clean and compliant by documenting and coding with the utmost inaccuracy and specificity and stay truthful to the patient's condition. Stay tuned for these fraud, waste, and abuse updates from me every month. Last Wednesdays of the month are when they drop. And now, it's time for my best practice tips in Trusty Tip. ICD-10-CM has been around since 2015, and coding guidelines dictate that diagnosis codes are to be reported to the highest level of specificity, especially since the specificity difference between ICD-9 and 10 is enormous. We gained tens of thousands of new codes related to greater levels of specificity. This therefore requires medical record documentation to reflect specificity as well as to capture diagnosis coding accuracy to the fullest. So first remember to number 1, document all coexisting conditions related to the patient's current health status. Per ICD-10 guidelines, quote, code all documented conditions that coexist at the time of the encounter or visit and require or affect patient care, treatment, or management, end quote. Second, document the current status of the condition. Document details regarding the current status of the condition, such as acute, recurrent, chronic, acute on chronic, in remission, etc., including the date of onset. Third, document the anatomical site or location. With this increase in specificity, documentation needs to identify the specific anatomical site or location in order to code appropriately. Fourth, document the laterality, the side of the body that's affected. Ensure documentation specifies the sides of the body affected. Fifth, document the etiology or the origin of disease. ICD-10 contains coding instructional notes throughout to use additional codes at an etiology code and a code first note at the manifestation code. Be sure to include the underlying etiology or cause, such as infectious agents, physical agents, internal failures, congenital, etc. Sixth, document the manifestation or the complication. ICD-10 also contains combination codes in which a single code classifies 2 diagnoses: a diagnosis with an associated secondary process, which is a manifestation, or a complication. Documentation should show a clear causal relationship between any condition and its respective manifestation or complication with linking verbiage such as due to, caused by, secondary to, etc. Seventh, document the severity of illness. Documentation needs to provide the extra level of detail for severity of an illness in order to assign the most appropriate ICD-10 code, such as mild, moderate, or severe. Eighth, document the episode of care. Is it initial, or subsequent, or sequela? Documentation needs to specify the episode of care as this impacts the 7th character for ICD-10-CM, code assignment, of most categories in Chapter 19 for injury, poisoning, and certain other consequences of external causes. These 7th characters, common character values, are A, D, and S. A is for initial encounter, or for use when the patient is receiving active treatment. D is for subsequent encounter. It's for use after active treatment, when you're receiving routine care during healing or recovery. And S is for sequela. It's for the use of complications or conditions that arise as a direct result of a condition. And finally, 9th, the signs and symptoms and unspecified codes may be appropriate to code, because per ICD-10 guidelines, quote, while specific diagnosis codes should be reported when they are supported by the available medical record documentation and clinical knowledge of the patient's health condition, there are instances, though, when signs or symptoms or unspecified codes are the best choices for accurately reflecting the healthcare encounter. Each healthcare encounter should be coded to the level of certainty known for that encounter, end quote. Remember, physicians and certified medical coders work side by side. They're on the same team. They should work together to ensure the medical documentation is clear, concise, consistent, and complete. By painting all the fine details into the medical picture, a certified medical coder can abstract codes with accuracy. And finally, this week's inspiring quote in Spark is from our American poet, Henry David Thoreau. I am grateful for what I am and have. My thanksgiving is perpetual. I thought this to be so poignant and fitting this day before Thanksgiving. I know I am grateful here in healthcare for the accomplishments we have made during this time of the COVID-19 pandemic. I know I am thankful for our genius scientists and researchers and remain hopeful these new vaccines from Pfizer and Moderna will pass FDA scrutiny in the days ahead. I am happy Henry David Thoreau's spark burns brightly in all of us today. So that wraps up today's episode. I'd love to get your questions and comments. And if you would like to inquire about my consultant services, you can always reach me through my email address at nexsenpruet.com. I'll leave links to everything in the show notes below. Please continue staying safe and healthy. Practice safety for one and all during our collective life in the time of coronavirus. Thank you for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday. If you want more information from me, go ahead and follow me on LinkedIn or send me an email at sonalpatel@nexsenpruet.com for all my consulting services in medical coding, auditing, and compliance. Thank you.